The content of this video is not medical advice or a substitute for physical therapy. Please consult your physician or physical therapist before starting any exercise program.
Today I want to share with you some tips on how you can improve your mechanics walking downstairs so you don't have knee pain. Now, whether you started having knee pain walking downstairs as a result of an injury or maybe a surgery like a total knee replacement or an arthroscopy, I find that if you're still having knee pain even after physical therapy when you walk downstairs, it's probably a mobility problem. So what I want to share with you today are a couple of simple mobility exercises you can start doing right away, and you'll probably see pretty quick results. So to get started, I want to share with you what walking downstairs looks like. I'm going to go ahead and pull up my pant leg so that you can see my knee and my ankle. And then I'm going to take a step down, and what I want you to notice is how much ankle bending I need to step down comfortably for this knee to not have any pain. So it's a pretty big amount of ankle bending you see there, but the other thing I want you to notice is that my hip is back over my foot and ankle. And that means that my hip has most of my body weight in it. Now, if you're having knee pain walking downstairs, what you're probably doing is something more like this. You're probably lifting your heel a little bit as you step down, and you can see that shifts my hip forward and drives my body weight over my knee, creating a lot of shear forces at that joint. And that can be really uncomfortable, especially when your knee is no longer 100%. So in order to fix that, we're going to do some exercises that are going to target two specific areas. The first area is that ankle. Now, to do the ankle exercise, you're just going to need an elastic band, and you probably have one left over from physical therapy somewhere. You're going to tie that low to the leg of a table. That's exactly what I've done here. I've just tied it low, and I'm making sure that band goes right around the top of my ankle. Now, I'm going to step forward until I can really feel the tension in that band. So you don't want it to pull so hard that it hurts, but you definitely want to be able to feel it. Both feet need to point straight ahead, and your heel needs to stay down here. Now, what we're going to do is simply bend and straighten this back knee. So make sure that as you're bending this back knee, that the foot is pointed straight ahead, it's not rotated out, and that your knee is going straight towards the middle of your foot, not inward towards your big toe. So we want nice, straight motion here. And you're just going to bend this knee as low as your knee and ankle will allow you to. The band is actually pulling the top of the ankle back and allowing the joint to glide better. So if you watched my ankle mobility video that I put out recently, this is kind of the next level of ankle mobility. So you're going to repeat this 8 or 10 times, and then if you want to, go ahead and get back on that step and see if stepping down feels a little easier. Now, what happens a lot of times after we work on ankle mobility is that folks say to me, okay, that does feel a lot better, but I still have all this tension, all this pulling along the top of my knee. Now, that's very common after both injury and surgery because it's your body's way of stabilizing a damaged joint. So what your nervous system will do is it will ask that quad to really tighten and tighten the tendon here, the quadriceps or patellar tendon, in order to stabilize the knee joint. Now, there's a lot of stretching that goes on in physical therapy to try to improve that, but if you've been out of physical therapy for a while, you've probably forgotten about all those stretches, maybe you haven't been doing them, and that can make that area tighten back up again. Now, the problem with that tightness along that tendon is that that tendon, because it goes from the quadriceps, this big thigh muscle, it encases your kneecap, and then it inserts down here on the top of your lower leg bone. When that tendon is tensioning, when it's pulling tight, it's actually smashing your kneecap into your knee joint. So when you're stepping down and you're loading that leg, it's kind of crushing your kneecap into the joint, which can cause a fair amount of discomfort. Now, the solution here is not necessarily stretching because we're talking tendon here. So it doesn't respond to stretching as well as muscle does, but mobility work it will respond to. So a simple exercise, this is probably my favorite one for improving knee flexion, is to go down to all fours, ideally on a padded surface, and then you can tuck your toes under. You can get a little bit more ankle bending there, and then send your hips back. So you might not have quite as much mobility in your knees and hips as I do here, but just go back as far as you can without pain or strain. So once again, if this hurts, you're going to have to either limit your range of motion so that it doesn't, or skip it altogether. But I think this is a really good way to start to improve the length of that quadriceps tendon. Practice it 8 to 10 times. Now, some people tell me they just can't be on their knees, and if that's the case for you, why don't you grab a dog leash or a stretching strap, and you just simply put that leash over your foot and then lie on your belly. And with your legs close together, you're going to use that strap to bend your knee. And you're just going to bend the knee as far as it comfortably goes, and then you're going to let it straighten a little bit. So you're just, once again, just like in the all fours stretch, or all fours position rather, you're just going into and out of that bent knee position. Once again, 8 or 10 times in a pain-free range of motion. And once you're done with that, you should feel like you've got a little bit more room over that knee, around that tendon. Now, once again, I would encourage you to get back on that step and just see if it's a little bit easier to step down without knee pain. Now, I do have a bonus tip, a third tip for you, but before I give it to you, I just want to remind you that if you find this information helpful, please go ahead and click all the buttons, hit like, give me a few comments. I'd love to respond to those, and then also share with friends and family who you think would benefit from this information. We really appreciate that. All right, so my bonus tip is this. If we do all of these things and you're still having just a little bit of discomfort, but right at the bottom of the stepping motion, I would just invite you to remember your hip. And what I mean by that is, I'm going to go ahead and put my hands on my hips so you can see this. As you step down by bending your ankle and knee first, so let me remind you of that, you can reach with this other hip. So this is my right hip that I'm reaching with, right? So I'm going to bend my knee and ankle first, but I can get just a little bit more motion by lowering this other hip. Now, that's a natural motion. Some people sort of balk at that, but that's a natural motion. We do that when we're walking downhill anyway. Perfectly acceptable to do stepping down. Just make sure that the bulk of the action is coming from the ankle and the knee, and then the rest is coming from the hip. Okay, that's all I've got for you this week. Until next time, keep moving and be well.